And welcome back. Well, it's estimated that lung cancer will account for more than a quarter of all cancer deaths this year.
And joining us now to discuss minimally invasive diagnosis procedures for lung cancer is Dr. Stephen Lee with Aurora St. Luke's Pulmonary Services. Nice to have you on the show, Doctor.
Thanks for having me.
Thank you for being here. And I want to mention you're a board-certified, fellowship-trained interventional pulmonologist, which means what? And I know you specialize in the minimally invasive procedures, right?
So for a general pulmonologist, they will go through 3 years of training. After my 3 years, then I went to the University of Pennsylvania, did a dedicated year of interventional pulmonology. So it is a subspecialty within general pulmonary medicine. Our focus is on advanced diagnostic bronchoscopy and also on therapeutic bronchoscopy. So because of that interest, really we're seeing a lot of patients with lung tumors, lung masses, lung cancers, or any other type of cancer that metastasizes or spreads to the lungs.
And you work specifically with diagnosing the exact tissue diagnosis. So why is that important? Why is it important to get in there and figure out exactly what's going on?
Well, I think cancer therapies have really changed over the last several years. And in the past, if you just had a biopsy that showed cancer cells, you were done. In terms of you didn't really need to know more about that because there was only a few standard regimens that could be utilized. Nowadays, we're able to do genetic testing and we're able to do what's called more personalized lung cancer therapies. So I think that's why really the amount of tissue that we're able to obtain for our pathologists then to give that information to our medical oncologists, our radiation oncologists, and our thoracic surgeons is very beneficial.
Few statistics for people. Lung cancer is the second most common cancer in both men and women, not counting skin cancer, and it is by far the leading cause of cancer death among, again, women and men, and every year more people die of lung cancer than colon, breast, and prostate cancers combined, and will account for almost 30% of all cancer deaths in this year. Are we not making much progress? Is lung cancer not getting the publicity it needs because it's seen as kind of a lifestyle? You know, people who smoke, you know, it's seen as a lifestyle choice almost?
I think there's a couple issues with this. One is the stigma that you've discussed, and a lot of people say that, well, you've smoked for 50 years, so you've sort of done this upon yourself, or, you know, why didn't you stop smoking earlier? The other issue is, unfortunately, that most lung cancers, almost 80% of lung cancers, are diagnosed at a stage where surgical resection is no longer an option. And for lung cancers, if you can't, quote, cut out the lung cancer, your risk for cure goes much lower. And so I think that's the other major issue is we don't diagnose lung cancers early enough. So we're diagnosing people with stage 3 or stage 4 lung cancer.
Are there good screenings and tests for it?
Well, interesting question. About 2 years ago, for the first time ever, there is a new screening procedure which is shown to benefit people in terms of reducing lung cancer mortality and also mortality attributed to other causes. It's a low-dose CT scan. So everyone knows about CT scan for the heart. That's been publicized quite significantly, but now low-dose CT scan for the lungs. Unfortunately, not all insurances are covering it. So we have patients who approach us, and then you have to have that discussion. I think one of the other major issues is these low-dose CT scans are finding a lot of things that maybe don't need to be biopsied. And so you're giving people this anxiety component about now, why I see a lung nodule, what is it? But remember, not everything that's a lung nodule is, or not every lung nodule is cancer.
Is part of the issue that maybe people who would approach you with symptoms tend to be those who have a lifestyle issue, such as smoking, where a lot of lung cancer, my aunt is battling lung cancer right now, and she's never smoked a day in her life.
Yeah.
So she wouldn't have really, you know, approached a doctor.
No, she wouldn't. And frankly, the low-dose CT scans are not indicated for your aunt. Unfortunately, again, the problem is that the symptoms can be very late. Most patients, we see a lot of patients that come in with just a routine x-ray for some other reason. Say I had shoulder pain.
Yes.
And so I got an x-ray, and then, boy, there's a 6-centimeter mass in their chest.
That's how she found hers.
So
shoulder pain.
Usually you're not having symptoms of cough per se or coughing up blood, which most people attribute or think is, you know, due to lung cancer. But oftentimes, you know, we see patients say, I had a routine x-ray for something else, and then unfortunately they find the cancer.
Let's talk about the minimally invasive procedures for diagnosis, because there's a mucus testing that you do. Chest x-ray is the one I think that people traditionally think of for diagnosis. There's a little camera with a needle, and ultrasound even that can pinpoint problem areas to biopsy. This is exciting in this particular field in treating this very deadly form of cancer.
I think it is. I think we've made a lot of advances in the last decade in terms of how we diagnose. Now, obviously, things you said, sputum cytologies, that's when a patient will expectorate their secretions, very low yield. So generally what happens is, based on what we see radiographically, that we then decide what type of biopsy technique is best for them. The nice thing about Aurora, where I work at, is that we have the full complement. So whether it's something that I do with a camera down the throat, or whether it's a radiologist who does a CT-guided biopsy, or in certain instances even having surgeons who do minimally invasive surgeries to diagnose cancers, is beneficial as well. So we have the full complement, which is nice, because then for each patient, we just see what's the best one for them.
And I love the personalized care. Also, afterwards, I know a nurse navigator can help answer questions and provide information on resources as well as support services to the patient. I know Aurora Healthcare also offers tobacco cessation classes at certain sites. Definitely want to call today to meet with an Aurora St. Luke's pulmonary expert, available at one of the many Aurora hospitals or clinics that's close to your home or work. So call this phone number. It's 414-649-4541. Or go to aurora.org/cancer care. So nice to have you on the show.
Thank you for having me.
Appreciate it.